everyone. I'm Leah Zickmund, Executive Director here at Hourglass. Welcome back to another episode of Listening to Lancaster, where we focus on quality of life issues in Lancaster County by talking to experts in the community who can share more about what they know. Today, I'm here with Dr. Edward Chory, retired general surgeon and chair of the board of the local Partnership for Public Health here in Lancaster. We're talking about an issue today that can be slightly divisive. And so what I wanted to do is just start off by, committing to the values of Hourglass, of being a nonpartisan organization that's here to provide trusted information to our community to make better decisions moving forward. And so today what we want to talk about is firearm safety and firearm death prevention. And I want to sort of just contextualize why I'm talking to Dr. Chory today. So on February 8th in Lancaster newspaper, Dr. Chory submitted an editorial about a national conversation on firearm violence related to violence happening in Minneapolis, and sort of saying that there's maybe a bipartisan swap happening in the conversation. So as we've designed our conversation today, we've decided, instead of talking about debates of the Second Amendment right, we want to talk about this as a public health issue here in Lancaster County. And so I want to hand it over to you, Dr. Chory, and thank you so much for being here today. The place that I wanted to start with is actually language. So we've talked extensively about the importance of language and being able to communicate and resonate with multiple audiences. So today we're using the terms firearm safety, and I wanted to just kind of ask you about why we're doing that, and then also, why we're talking about firearm safety as a public health issue here in Lancaster County.
Well, your question brings up several or two very important points that I'd like to make right off the bat. Is the importance of language and how people are listening very carefully and make assumptions based on the language we use, the words we say. So instead of gun violence prevention, firearm safety or firearm injury prevention hopefully allows people to not make immediate assumptions that a gun advocate is going to take away guns. We need to talk about this in a nonpartisan way, and that was the message of the editorial or the column that you brought up from February 8th, that this tragedy in Minneapolis all of a sudden had each side talking from opposite directions of infringing on Second Amendment rights or not. And like you said, we don't want this to be a political discussion. We want to save lives. We want people to be safe. So the number of people that are dying because of firearm injuries are so much larger in America than anywhere else. So we all have to sort of sit down and discuss this in a non-emotional way to see if we can come up with solutions. You talk about building bridges or rebuilding trust in the public health establishment, in our government, in all of our institutions to try to solve this problem without language that right away leads people to repeat talking points and close their mind to, we need to do more to prevent unnecessary deaths.
Right.
The second point is about public health. Public health has lost a lot of trust, especially since the COVID epidemic, because it was viewed through a partisan lens. And so we need to try to establish a relationship with the entire community to help people understand public health is not the same as healthcare. So I, as a surgeon, took care of individuals. We in Lancaster are blessed with so many good healthcare institutions, Penn Medicine, Lancaster General, Penn State, UPMC, WellSpan, and they actually provide a lot of services for public health, but their main goal is to treat individuals. Me as a surgeon taught or took care of individuals. Public health is about public safety, about safe water, about safe food, restaurant inspections, about public health in terms of vaccinations, which has also become a very divisive issue. So the bigger picture is, how do we communicate with each other on opposite sides of our political divide? I talked about laying down our swords, that we're not always battling people who are attacking our way of life, but deciding we're a community and we have to work together to help save lives.
Thanks, Ed. I wanted to contextualize and maybe give a couple of interesting statistics, some of which you brought up in your editorial. There was an event right at the end of 2025 hosted at West Art that was hosted by Ceasefire PA and Moms Demand Action, which are both advocates for firearm safety. And so one of the statistics that I saw circulating around quite a bit at the end of last year was that Lancaster County was reporting the lowest number of homicides since 2010. 6 homicides in Lancaster County in 2025, which is the lowest in the century, and again, tied with 2010, which is huge. That's really important. What we learned at that event, Ceasefire PA had also shared that in 2025, by December 15th, I think is when the event was, so almost at the end of the year, 46 people had lost their life due to what they quoted as gun violence. You may use a different term for that. And so what you were sort of talking about in your editorial was oftentimes we talk about maybe homicides or school shootings or things like that, but other unsafe firearm situations are not necessarily always being spoken about, and that it's important to speak about those from the context of public health. So I'm curious if you wanted to add to that and talk about that a little bit further of your argument for, why are we not talking about that on a larger scale?
Well, I think that also helps hopefully depoliticize and humanize the reality of this problem, because, like you alluded to, the school shootings and the shootings in urban centers, how many murders were there in Chicago and Philadelphia? And I'd like to add, as I mentioned, those two urban areas that are often pointed at as being so violent and unsafe, over the last 3 or 4 years, they've had a dramatic decrease in deaths in the city because of firearm violence, because of community intervention and safety programs where they're teaching people in these economically depressed areas to de-escalate arguments, to not go to violence right away, even in the face of the ubiquity of the guns. So the media directs, and the public just gobbles it right up, all our attention to urban violence and school shootings, whereas suicides comprise almost 60% of all the deaths because of firearm injuries, and has been for years. So that's where the whole idea of personal responsibility and safe storage comes in, with the potential to save so many lives. So now we're not talking about legislation. We're not talking about the Second Amendment. We're just talking about the responsibilities that come with your right to bear arms, that you can save your son's life, your neighbor's son's life, and so many others by just being aware of preventing any unauthorized access to a firearm. There's a wonderful. Oh, go ahead. I'm sorry.
You've said the word responsibility, which I think is strong. it makes me think about where does the responsibility of firearm safety exist? And I was really curious. You shared an article with me from the Journal of Lancaster General Hospital's Winter 2025 edition. And in that article, you were sort of tracing the history of physicians being participating in this conversation. What is a physician's sense of responsibility to enforce or not enforce firearm safety? And I'm curious if you can sort of share a little bit about like where did that conversation begin? Where is it now?
So, over 30 years ago, the American College of Physicians issued a statement that was published in the Annals of Internal Medicine, their monthly journal. It was a call to physicians that they should be addressing a public health issue of firearm injuries and discussing firearm safety, specifically safe storage, with their patients.
And this would be like in general appointments, like just general
Well,
doctor.
exactly.
Yeah.
They really didn't specify that kind of detail in that position paper.
Mm-hmm.
But two school shootings engendered two more policy statements, one in 2014 after Sandy Hook that occurred in December of 2012, and then one in 2018 after the shooting in Parkland, Florida at Marjorie Stoneman Douglas. And they were much more adamant about the responsibility of physicians, calling it a special responsibility to discuss safe storage, particularly in homes with children or people with mental health issues or with dementia, in terms of being sure firearms in the home are not accessible to people that can lead to harm to other people. And that engendered a response from the NRA that doctors need to stay in their lane. And that engendered a response to the response, where doctors said, this is our lane, and created more organizations. So it's only in the last 8 years when more doctors have become more aggressive advocates to discuss this. And whether that's on a routine basis with every patient or when it appears it's appropriate, is still being discussed. So there's the system in New York City, Northwell, who recommends it be a routine thing. So that way it's never left out. Where out in Colorado, they felt there can be a little more selection, sort of a screening process as to where you discuss it. Pediatricians have led sort of this discussion for the last 6 years, after in 2020 the leading cause of childhood mortality was noted to be firearm injuries. So they felt it was their responsibility to discuss gun safety with their patients much more aggressively. That's what led our local group with Dr. Pia Fenimore and Lindsay Pringle from Lancaster General to get a grant from the Pennsylvania Department of Health, and they now run firearm safety classes in partnership with the sheriff's office. So it gives them more credibility, also with the Mental Health Association. So this is not a problem that has one solution. It's so multifactorial. And so the coalition that they've built, I think, has added some credibility and has been very enthusiastically received, where the sheriff's office representative gives a long discussion on the importance of firearm safety. And at the end and the Mental Health Association also discusses the importance of just being aware and being sensitive to the signs that your loved one, someone you're friends with, a family member, are struggling, and how to approach them and to try to get help to prevent these kind of tragedies.
And I'm curious, and I apologize, I did not prepare you that I would ask this question. But when I'm thinking about, pushback to this conversation you're laying out, which is it within physicians' lane to take on this issue versus is that someone else's responsibility? Are there other issues that have been adapted by physicians that kind of had a similar, like this isn't in your lane? One thing I'm thinking is domestic violence. I believe that certain doctors ask you, like, are you at risk of harm or anything like that? Is it a cultural shift that just needs to be understood? Like this is an issue that medical professionals should have some sort of stake in, and here's an example of something similar or a parallel.
Well, full discussion, and you put it in the context of domestic violence, which is another sort of topic that's swept under the rug. It's awkward to talk about, just like mental health. And I could be mistaken, but I believe that is a requirement, especially in the emergency room, that women in particular, and you could debate whether it should include men, are asked that question: are you safe in the home? Is there a gun in the home? So that's part of it, and that needs even more attention. When you bring up that specific question, has there been precedent examples in the past? So I remember back when I was the director of trauma in the late 90s, Pennsylvania was in the process of repealing the motorcycle helmet law. And I wrote a letter to the editor citing studies from California about the problems with motorcycle helmet wearing and the number of fatalities or life-changing neurologic injuries and the costs of that. And I got death threats. This is in the 90s, so long before social media. The politically charged nature of doctors lecturing their patients about what's good for them. Pediatricians use the example of bicycle helmets, which is basically the same as motorcycle helmets. They just don't go as fast. And their riders are typically, but not always. So it's interesting. And they bring up seatbelts. And of course, smoking was discussed. And here, doctors used to advertise Chesterfields, chosen by, 4 out of 5 doctors. So much has changed over the years when physicians are expected to try to treat the entire patient. Here we were talking, I alluded to the difference between healthcare and public health. And the medical establishment rightly gets criticized that we are a system that treats illness and waits for catastrophe. We like the heroic save, the heart attack, the stent that saves someone's life that has a widowmaker lesion in their coronary artery, and we don't do enough about preventative medicine. A stitch in time saves 9. An ounce of prevention is worth a pound of cure. And our system is not geared to do that. And that's what public health is supposed to be about on a community level. What makes us safer as a community? Mm-hmm. And that's, here I'm going to use that R word, responsibility comes in, that we have to understand if we're going to be doing things that can be dangerous, whether that's driving a car, riding a bike, putting our kids in the back seat of our car, we should do everything we can to make that safe. So if we're going to own a firearm, we need to be as safe as possible to prevent people from being harmed. Mm-hmm. That's what it boils down to in simplest terms.
Yeah. And something that you wrote in your article, quoting from Every Town for Gun Safety, across all suicide attempts not involving a firearm, just 4% result in death. Approximately 90% of gun suicide attempts end in death. So, in that statistic, you can see a direct correlation between the presence of firearms and higher mortality across the board, which is very scary to think about. And it certainly is not something that we just talk about with numbers. It has totally changed the lives of people who have been affected by um, firearm deaths. And so, in talking with you, Ed, and understanding, your long career, I can tell that there's a sense of responsibility that perhaps you feel to advocate more about this issue in a bipartisan way. Is that correct?
Absolutely. That's the most frustrating thing about it. And, quoting Matthew 7, it's easy to point to the splinter in your brother's eye and not see the plank in your own. Everyone has their sort of political bias. And this whole issue of believing only what you already believe to be true, or accepting or willing to listen to someone talking about a problem in a way you're not used to thinking about it, is the biggest hurdle to helping to decrease the number of deaths. You mentioned the statistics of the efficiency of firearm suicide, which is frightening. And one of the points to bring up, the majority of people, and my wife has a cousin who attempted to kill himself. He put a gun under his chin and he blew out one of his eyeballs and he survived. And the statistics show he's one of the 10% that actually survived an attempted suicide with a firearm. That most people, whether it's with a firearm or with a medication or hanging, that survive a suicide attempt do not go on to try again to end their life. So if we can prevent the use of these efficient suicide implements, they talk about lethal means, preventing access to lethal means is sort of a code for making sure people in mental health crisis do not have access to a way to harm themselves. Figure out a way to connect with people. This is all about trying to get people to understand that this is something for a community good, for your loved ones. We all want to preserve life and respect each other's right to life. And I know another code word, but we won't go there. And so that, like I said a few minutes ago, is the most frustrating part of this, that the ability of people to grab onto a phrase and then all of a sudden turn it around, meaning we can't cooperate in this kind of endeavor because it's impacting what's important to us, is so counterproductive. And how to find ways to keep the dialogue open. That's why I'm so excited about Ketch Sikor and David Green returning to present their documentary Louder Than Guns. So here's a country singer, well known with the Old Crow Medicine Show, that reacts to a school shooting in Nashville, Tennessee, where he has children in school. And it is very much personally affected by this event, who is realizing he's got an audience of people who might not appreciate how important their behavior can be in preventing these kind of, and he's trying to reach out to a community that seems to not be open to the idea that we can do better in protecting our children.
Mm.
and to protecting each other. It's not just children in school shootings. It's the kids in Baltimore and Philadelphia and the adults, the young adults whose lives are cut short unnecessarily because we're such a violent society. And the fact that we're a violent society and then have so many firearms, we've got to be able to come up with ways to do better. I'm not saying the answers are easy. There are no easy answers,
Right.
but you need everybody that's got skin in this game or an interest to sit down and in a hopefully unemotional and open-minded way, try to figure out what we can do to make things better and safer.
And to your point, that event I will be linking for those of you who are watching and are interested in attending. It's on March 18th at 7 p.m. at the Ware Center. Be able to watch the film Louder Than Guns, and then be part of a discussion, I'm assuming, surrounding the film.
Yeah. Mhm.
Um,
In
and I
fact,
knew
Mara's
this.
on the podium, and I think Martha Harris, who's involved with One Voice, a faith-based community organization that wants to address firearm injury prevention, is also on the panel that's going to be discussing it in a Q&A. While we're sort of promoting events, I think I sent you the schedule
Yes, I
for
will be
Dr.
sharing those
Fenimore's
dates.
and Dr. Pringle's gun safety classes for 2026. Which are definitely worthwhile and something that people can learn a lot about firearm safety.
Yes, so I'll be sharing the Louder Than Guns invitation, the trainings, and then also some of the literature that we mentioned that you've either written or collaborated on, just so people can reference. I knew this would happen, that our time would fly by really quickly, and we're in our last 2 minutes. Is there anything that I didn't ask you about regarding this conversation that you wanted to clarify or talk about before we wrap up?
No, not that I can think of off the top of my head. To mention a couple more of my heroes, though, since we have a little time. Dr. Saccharin is a trauma surgeon at Johns Hopkins, and he and Dr. Megan Ranney, who's up at Yale in Connecticut, um, are sort of the founders of the This Is Our Lane movement, which has testified before Congress and is providing all sorts of information for doctors to discuss this in a nonpartisan, non-judgmental way with their patients, hoping to make this a regular part of doctor-patient relations.
That's great. Yeah, I would love to include work of theirs in what we share with our Hourglass audience. Um, well, Dr. Chory, thank you so much for your time and for being willing to enter this conversation in a way that maintains the trust that we have of our Hourglass audience, which is to be nonpartisan, to provide information, to be able to, start conversations that may be difficult. Something that I've said quite a bit in my time as executive director here is there are difficult conversations to be had. It doesn't mean we don't have them. And so for those of you who are watching, we'd love to hear just sort of any thoughts that you have and maybe see you at some of these events. And again, I thank you, Dr. Chory. I
No,
really
thank
enjoyed
you. I hope
talking
you
with you.
share those comments with me and we can continue a dialogue with the community.
Wonderful.